All right, so we've got a woman who shows up in the ER with complaining of vaginal discharge, abdominal pain. She has a oral temperature of 103 degrees, nausea and vomiting, preventing her from eating for the last 24 hours, increased bleeding with her periods, and the temporary diagnosis is that she has pelvic inflammatory disease. So um, we are trying to figure out which laboratory tests would show that she has PID, and the one of them is going to show just we could do a white blood cell count or a CBC, and we'll see that her white blood cell count has increased. We can also, through a urinary test or a swab test of the vagina, we can test for bacteria. Because we know that chlamydia or gonorrhea often cause PID, we can test for those bacteria. And we can also, there are times when an ultrasound will be done to gather further information about the reproductive organ health, as well as an endometrial biopsy to get a bit of tissue to examine. And then sometimes they'll use a camera and do laparoscopy. So just, again, taking a look at the health of the reproductive organs. What information do we want to gather from the client? So we want to discuss, of course, in a sensitive manner, what her sex habits are. We want to be sure that she understands that using a condom is going to be the only way to protect, or using the barrier method of contraception is going to be the only way to protect from sexually transmitted diseases. And that's exactly what we're faced with here, is a bacterial infection that is spread to the upper genital tract. So we'll also want to be sure that she's using proper hygiene, which, by the way, does not include douching. We want to make sure that that's not a part of her routine. Tampons are also actually listed as something that's not good. And we also, as far as partners go, she should realize that multiple partners is going to increase the likelihood of infection. Also, having a new partner, something that's a change from her routine, could also be a reason why she has this infection as well. We also want to see if perhaps she was showing any signs of the gonorrhea or the chlamydia before. So if she was having, for example, like the flu-like symptoms, or if she was having any foul smelling discharge. You want to be sure that, she's not ignoring those symptoms, especially if this were to happen again. And she should also realize that the longer that she goes with these symptoms, the worse the infection can be, and the more extreme consequences could result from this infection. There actually can be permanent damage done, despite the fact that the PID itself is curable. So some interventions for care, a broad spectrum antibiotic, and a couple different options present. One is ceftriaxone, 250 milligrams of a one-time single injection, as well as doxycycline, 100 milligrams twice a day for 14 days, making sure that all 14 days are taken, even if the symptoms subside. Or cefoxitin, 2 grams intramuscularly, while at the same time getting provimicid, 1 gram orally, and then also the doxycycline, 100 milligrams orally twice a day for 14 days, with or without metronidazole, 400 milligrams oral twice a day for 14 days. Again, we want to make sure that all the medication is taken, even if symptoms subside. We also want to be sure that tetracyclines and quinolones are avoided if she's pregnant. And we want to be sure that she gets plenty of bed rest. It's important for the healing and to get control of the infection. Also reduces the amount of stress that she's going to have to undergo. Also, just less movement could be quite helpful, for her. Then lots of water. We want to be sure that she's eating healthy food. Just like any other infection, the body heals itself when it has all the nutrients and all the proteins that it needs for proper protein development and electrolyte balance. Again, no douching or tampons. For pain control, we want to be sure that she's addressing it with aspirin, ibuprofen, naproxen, one of those. And using a heating pad has been helpful for people in the past. We want to make sure that she does not have sex until the infection is gone and the doctor says it's okay. And then, when it is okay, we want to be sure that she realizes that condoms, again, are going to be a good option for preventing sexually transmitted diseases. Although they don't prevent all sexually transmitted diseases, because there are some that, such as herpes, which, can still happen because of skin-to-skin contacts outside of that condom area. We also want to be sure that she tells her partner about the fact that she had the pelvic inflammatory disease, and that partner should get tested and, if needed, treated. Otherwise, there's a good chance of this infection recurring within her again. She should also keep her appointments with the doctor, even if the symptoms do subside. Oftentimes we assume that everything's good to go and that we can return to our normal lives because we feel better. But we need to be sure that the bacteria that cause this is absolutely out of the system. Also, again, this is something that she's going to want to catch as soon as possible and not just live with the pain, because, again, she could be doing irreversible damage to herself by doing so.